Let's return now to our top story and the heart problems mid-game, not unheard of in football, very rare indeed. I'm joined now by consultant cardiologist Dr. Iqbal Malik. Good morning to you.
Good morning.
What could have happened here with Fabrice Muamba? I mean, the surprise is, I guess, is that he's so young and we know so very fit. What could have happened?
Well, I think what it isn't is a heart attack in lay terms, because that's when an artery blocks off. It's the sort of thing that the 8 Heart Attack London centres treat all the time in these young athletes. He's had a cardiac arrest. The commonest cause in an older person would be a heart attack, but in young people like this, it tends to be heart muscle disease sometimes, or a strange salt imbalance that can occur inside heart muscle cells themselves. Occasionally in sort of more violent sports where you get hit on the chest, you can get a shock suddenly to the heart which can set off a rhythm problem. But I think for him, it's going to be either a heart muscle problem that hasn't been picked up up till now.
Would that be a congenital condition then, something he's had for a long time?
Yeah, so 2 types of congenital condition. There's the blue babies, holes in the heart. That's not what he's got, I'm sure. There's a very subtle problems with the way the muscles link together in the heart, which can be very difficult to pick up, despite the very aggressive screening that all football players undergo now.
I mean, it raises very serious questions, of course, as to what can happen in terms of his recovery. But in terms of the treatment he's getting now, we know he's getting specialist care, he's in intensive care, so we've been told. I mean, what sort of treatment will he be getting?
So the first thing to say is that the ambulance crew should be congratulated, because there's nothing the hospital can do unless the patient's heart is restarted. And over the last 6-7 years, the ambulance crews in London in particular have got very good at restarting the heart. So I think his heart was restarted, he's got to hospital. The first stage in that first 24-48 hours is actually trying to make sure that the brain recovers as much as possible, because the heart's restarted, the heart rhythm will be monitored, but hopefully it won't reset off in that odd rhythm it must have had. But cooling the body helps the brain recover as well as the heart. And so I'm sure they're on intensive care, helping his breathing, maybe supporting his blood pressure with a few drugs, and cooling the body to try and make sure that his recovery is as good as possible.
When you say getting the brain to recover, I mean, are you saying there that obviously because the heart stopped for a period of time, what are we talking about, oxygen deficiency to the brain, which, I mean, raises questions, doesn't it, as to long-term implications here?
It does, and it's difficult to speculate about that, but because he's had this event once already, it's unexpected. Although he hopefully will make a full neurological recovery and get back to a very active life, the question is whether he'd be allowed to compete at the top level again, which is a disaster for him really. But I think the priority really is to get him recovered to a normal state of health before he becomes an athlete again.
Well, he is in the very best of hands, as we know. Good to get your views. Dr. Malik, thank you. Now, Sky News understands students and teenagers are amongst those being actively targeted by Syrian government forces.